And Medicare billing. Oh my goodness. This, yeah. So I suck at billing. I don't think I'll ever be a rich GP, and I've made peace with that. And a big part of that, I think, is that Medicare billing is complicated. It is I don't want to say outdated system. It is a system that has been set up for one purpose and is trying to fit the needs of the world today, which I think is perhaps slightly different to the world as it was back then. So it is something that is definitely worth spending some time wrapping your head around when you first come into general practice. Now, there are lots of online courses and programs to familiarise yourself with Medicare benefits schedule. You can get, I know Business for Doctors is probably the most commonly used one, and I've seen lots of people that say they've had fantastic experiences from that course. I haven't done it myself, so I can't vouch for it personally, though I should probably try and get an affiliate code or something. I don't know. I think the important thing it does, though, is give you that structured approach and to get you to actually read the item numbers for the things you're billing to make sure what you're actually doing is going to fulfill those codes and that you're not going to, down the line at some point, as we all will, get an audit and end up in deep trouble. So it's really, really, really important to make sure you're coding accurately to avoid billing errors. And the tricky thing is that by default, our response to this is to then just dumb it down, so to speak, and to essentially stick to our time-based codes. Now, while that is a safe practice, it's not always the best practice, and certainly in terms of financial reimbursement, it is possibly one of the reasons why so many GPs are dramatically underpaid or receive a much lower income than a lot of other subspecialties. Tied into that, I want to mention, though, private billing, and we're in this kind of awkward transition in Australia at the moment where there's fewer and fewer clinics doing just bulk billing. So bulk billing is the term by which the complicated setup, again, an antiquated system, but essentially the Medicare rebates are what the government has agreed they will pay to cover the patient's medical needs. So when we talk about rebates, they're not our rebates that we get as general practitioners, they are the patient's rebate as to what the government thinks that should cost to get money back. Now, bulk billing is where the practice agrees that that is the fee that will be charged, and so the standard billing process is bypassed so that the government then forwards that patient's rebate directly to the clinic. And the patient signs a slip to say, yes, I'm happy that this occurs. In practice, that means that the patient doesn't receive a bill per se, so much they agree to sign over their benefit, their rebate to the practice in lieu of paying fees to attend that session. Now, there's private billing as well, which is where the clinic has dictated that actually we think it costs this amount, which is different to the rebate. And the usual practice that occurs here these days is that the patient is charged the full amount, and that is then the information of that is sent to Medicare, and the rebate for that amount, which is a lesser value, then gets credited to the patient's account. So even though they're paying the full amount, they then usually almost instantly get that rebate amount added back to their account. Now, this has caused a lot of trouble in Australia because a lot of patients who perhaps were used to being bulk billed previously and not having that out-of-pocket cost now have to. And even though for a standard consult there may be $20, $30 out of pocket, in some places more, there is actually that much higher initial cost they have to pay before that reimbursement occurs. Now, again, there is the notion that healthcare in Australia has been free. Really, it's the government handling the rebates. In practice, for the patient, essentially they're not paying money to see doctors or receive medical care. And the way that the rebates have been adjusted for the last many, many years simply reflects that the government has not adjusted those to match inflation, to match rising costs of running a practice, And realistically, it's no longer viable to try and maintain a practice just off bulk billing. And the only way to really try and do that is to maximize the amount of revenue you raise through essentially seeing more patients, trying to rush through as many as you can, maximize rebates from things like care plans. And the fear, of course, is that we're then actually decreasing the quality of care that we are providing our patients. And for this reason, most practices now, I think, are charging private fees for patients coming in. That's a long-winded way of saying, if you are in a clinic that is charging private fees, I would strongly encourage you to bill privately from day one. And when I first came across, coming from a public system, I really didn't like the idea of charging patients. I held and still hold the belief that healthcare is a right, not a privilege, and that realistically the government should be investing in the population to keep them happy, healthy, so that they can go on to their workplaces, work in their jobs, pay their taxes, and the whole system then generates its revenue and money through that, and the cycle rinses and repeats itself. But sadly, that is not the way the world is working currently. And if we want to keep doors open, if we want to keep practices afloat, there are just going to have to be private fees associated with it. And sadly, that is just the way it is right now. Now, of course, to add an extra layer of complexity to this whole setup, the Medicare billing regulations and the codes that are used are changing constantly. And this is where speaking to your supervisors to get their understanding of things can be incredibly helpful, but also jump onto online forums, things like GPs Down Under on Facebook, a massive Facebook group of GPs all across Australia can be really, really helpful because what it comes down to is sometimes the item descriptions don't necessarily seem to say the same thing as what everyone's opinion is, and trying to get clarification can be like pulling teeth. There is a service called Ask MBS where you can pose these questions to the Medicare and receive responses. The trouble with that, of course, is that the responses that are given aren't guaranteed to be accurate, and if you base your practice off those responses and get audited, there is a chance they may say, sorry, that doesn't actually stand, we disagree with what was said then, and you are liable. Now, there was a big kerfuffle not long back, as I don't doubt you saw, about GPs and doctors rorting Medicare, and this is a big part, I think, of what got missed from that discussion through to the public, at least. It was definitely raised by doctors involved in this story, but the concern was that it wasn't adequately reflected that actually, if anything, GPs in particular, we're probably underbilling Medicare because we are sticking to our standard time-based codes to try and avoid getting audited for all the extra complexities and all the extra little bits that we could and realistically probably should be charging because we are so terrified of getting audited and being forced to then pay back money. So, of course, at the end we'll seek help from experienced colleagues, so people that have done proper billing, preferably been audited and passed or had as minimal paybacks as possible, or speak to billing experts. And as I mentioned earlier on, Business for Doctors comes highly recommended from most circles I have spoken to. Again, I have not done any of their courses myself, but a lot of people say that they have fantastic resources, so definitely where I would start my search.